It is a system under strain, considerable strain.
The number of COVID patients at record highs across nearly every state and territory. New South Wales and Victoria each recording 21 deaths.
Over 50% of people in ICU are unvaccinated.
What's been a strain on hospitals, now a full-blown staffing crisis. In Victoria,
it's more than 6,600 health service workforce who are unavailable to work right now.
The government considering instating a code brown, calling all workers back from annual leave.
What we are doing is looking at whether we need a system-wide approach to some of those issues.
And recruiting 1,000 extra staff, including health students and retired nurses, to help bolster its vaccine rollout.
This is just a further way that we're dealing with the extreme demand on our health system.
It comes as the PM held emergency talks with industry groups.
With so many people getting COVID, that is clearly going to take more and more people out of the workforce.
Omicron-fuelled staff shortages tearing through the workforce, causing havoc not just in healthcare, but across every sector.
The goal is to get as many people as safely at work in these critical sectors that keep Australia moving as possible.
Pre-pandemic, around 3 to 4% of employed Australians called in sick on a typical day. Now,
we're hearing 20 to 40% furloughing of workers because the worker is sick and has COVID, or because there's a little bit of confusion about whether or not that worker should come to work.
Despite restrictions being lifted across the country, worker shortages compounded by cautious consumers has seen spending levels plummet. Recent data showing spending in New South Wales at its lowest point since the pandemic began.
Working people have made incredible sacrifices and have stepped up, and it's being undermined by a Prime Minister failing to plan and therefore planning to fail.
So, as this shadow lockdown deepens, the health crisis spirals and the economy stalls, just what is the government's plan to turn this mess around?
Acting Small Business Minister Senator Anne Ruston was part of those meetings with critical industry groups, and she joins us now. Minister, businesses are crying out for government help right now. What are you going to do for them?
Well, the meetings that I've had over the last couple of days have clearly given us an indication of the issues that business are facing at the moment. And obviously critical work shortages, particularly in essential services, was the number one thing that they were looking at. So we're obviously seeking to work out ways that we can improve those the access to workforce. But I suppose one of the things that was really promising in discussing it with some of the bigger players was the changes that were made earlier in the week appear to already have started to work. They're starting to see people returning into their distribution chains, which hopefully we'll start seeing some of these food and groceries that have been so critical and have been the subject of this discussion starting to move again.
But Minister, the problem is really pressing right now, because we're hearing from every sector that this is worse than any of the lockdowns with none of the financial support. I mean, have you been too quick to turn off the taps?
Well, obviously, we are going through a significant gear change at the moment with the Omicron variant of the virus, but we stand absolutely ready to work with the state and territory governments and with the across all of industry sectors to make sure that we're assisting them to make sure that they're supporting the Australian economy and Australians who rely on these critical services. First cab off the rank, obviously, was food and grocery. Super important. And as we have now started to see some improvements in that area, looking to transport and logistics to make sure that we can continue to put in place the things that the Australian business needs to keep the wheels of business turning.
One of the things that businesses have been crying out for is access to rapid antigen tests. When you delivered your reopening roadmap, why were they not included?
Well, certainly there has been a worldwide shortage of rapid antigen tests. We're now starting to see, we have had several million who have arrived in Australia. The federal government secured. We know that state and territory governments have secured them, as well as the private sector, and we're expecting tens of millions more before the end of the month and into February.
But Minister, we keep hearing that they're coming, but they are one of the really central issues about why people aren't turning up to work, and the government continues to penny pinch on them.
Well, not at all, Lisa. The absolute priority for the government and the states, all governments, states and territories included, was making sure that we had the tests for people who had symptoms. So we've made sure that the 10 million tests that we had have gone to the state testing clinics. We've also prioritised those care sectors, aged care, healthcare, disability care and Indigenous populations. And as we work our way forward, we will make sure that we have got access for critical workforce. We also made a decision a couple of weeks ago for low-income earners and people who are on pensions. Over coming weeks, they'd get access to free tests to make sure that they were able to get access to them as well.
Leading epidemiologists are saying that this strategy in place at the moment is a let-it-rip strategy. Is it time for the government to admit they made a mistake?
Well, we have to learn to live with COVID, and we are absolutely going through a gear change at the moment. The Omicron virus, as everybody knows, is very transmittable. However, we are seeing significantly less serious impacts from the virus across Australia. But we have to move through this. We have to bunker down, and we all have to work together, because we need to get to the other side of this virus, because we need Australia and Australians to be able to get on to their lives.
Forgive me for interrupting, because I think we've all heard the gear change talking points many, many times now. You had this plan to reopen. You knew that there was going to be much more virus circulating in the community, and you didn't secure a strong supply of rapid tests that would enable the economy to keep running during this. Why didn't you?
We have secured a strong supply of rapid tests.
I'm sorry,
and they
Minister,
are currently coming
haven't.
into Australia.
You're sort of saying with hindsight, you didn't actually secure a solid supply of this, because we're now in this situation. Every business in Australia is crying out for them. Every hospital, every aged care home needs rapid tests. And you as a federal government didn't secure supply.
Well, as I said, there is a international shortage of this particular test. We have secured supplies. They are arriving as we speak. We have prioritised those areas that you point out, aged care facilities, healthcare facilities. But equally, we are making sure that we work with industry to make sure that the rules around the requirements to use these tests are focused on making sure we're only using them when we need to.
Minister, come on, we know you're doing that now. My question, Minister, with respect, is why you didn't do it before.
We have been seeking supplies of rapid antigen tests for some time. As I said, there is an international short supply of rapid antigen tests.
But Minister, if we were living in the UK right now, we could get immediate free access to a RAT every single day of the week. And we had the example of what was already going on overseas. You know, that's this luxury that Australia's had, and at every turn, from the vaccine rollout to kids needing to be vaccinated before they get back to school, not while they're still at school, at every turn the government seems to have not taken the cues that we've been handed from overseas.
Well, I wouldn't agree with that, Lisa. I think that over the last 2 years the government has been working very hard to make sure that we are responding to the conditions that exist in Australia. And as I said, Omicron's only been in this country for 6.5 weeks, and we are working with the Australian economy. We're working with all Australians to make sure that we get through this together, because we want to live a life free of the restrictions that have been forced on us for the last 2 years. And that's exactly what we're focused on. You know, we are focused on making sure that Australia can have the soonest possible recovery and get on with our collective lives.
Minister, let's hope it ends up that way. Thank you very much for your time tonight.
Thanks so much for having me.